Hello, my name is Bob, and this is the Aortic Toolkit. It has components to evaluate the valve leaflets and assess the annulus when intraoperatively performing aortic valve remodeling and repair. Part of this toolkit has a cusp caliper. This is to determine the intraoperative cusp height of the leaflet and also the geometric cusp height of the leaflet. It comes in several different sizes. You've got 10, 9, 8, 7, and 6 millimeter sizes. This part of the toolkit is called the Annular Obturator. The obturator is double-ended, and in between the ends is a piece of metal called nitinol, which is a memory metal. The reason why we put this in is so you could bend it and more or less gain correct angulation for making a precise measurement. Upon sterilization, nitinol will return back to its original form, which is straight. The measurements for these obturators are 19, 21, 23, 25, 27, 29, and 31 and 33. It should be noted that these obturators are not intended to be used as an obturator for prosthetic valve replacement. Just to reiterate, the components of this toolkit are intended to aid in evaluating anatomical and geometric relationships in aortic valve and aortic root repair. The tools may also be used to assess the need to narrow the annulus further in aortic valve repair procedures. Happy to provide further details or even a tray for trial. If you have any questions, give me a call. This is my email address for my company. And in the topic or the subject header, if you put AVR Toolkit, it would be greatly appreciated. Thank you very much. Good luck and have a great day.